Hello all. In this PT tip, I'm going to discuss why using the term post-concussive symptoms is better for your recovery than using the older term post-concussion syndrome. So what's in a name? Well, in this case, quite a lot. Medically, a syndrome is a type of condition that gives you a set of symptoms, but which can come from different sources. For example, patellofemoral syndrome causes knee pain. This pain could be related to problems in the feet, hip, or weakness and imbalance in the knee itself. Many clinicians are now questioning if this is the correct term to use. Instead, more and more of us use the new term post-concussive symptoms. Here are 3 reasons this shift should matter to you. First, while the symptoms undoubtedly came on with your concussion, for any given individual, it is much less clear why these symptoms linger. Next, the symptoms of concussion are kind of vague and non-specific. This means that symptoms could now be related to something other than your concussion, something that is being missed, lumping it under the general post-concussion syndrome term. Experts now say using the new term post-concussive symptoms leads to better treatments. This is because just trying to generally treat the thing called post-concussion syndrome is not as useful as going to a specialist for a given symptom. For example, a neurologist specializing in headaches and migraines, or a neurooptometrist for functional eye problems, or a physiotherapist or chiropractor for neck issues. It's important to realize that the approach used for post-concussive symptoms should not be the same as used during the concussion period. Let's start with the concussion phase. This phase lasts from 1 to 2 months after the injury. Except in the case of a flare-up or a new concussion, don't use the following rules beyond 2 months. First, if you have a given symptom, for example a headache, within common sense, be as active as you can. If the symptoms increase more than, say, 2 out of 10, or if a new symptom comes on, for example, dizziness, stop. Take 5 minutes rest, close your eyes, breathe deeply, and quieten your mind as much as you can. Next, switch to doing something different. If you were doing something mental, for example, insurance paperwork, switch to doing something physical. For example, go for a walk. All day long, keep switching back and forth between doing something mental and something physical. Pay attention to the level of your symptoms. If you wake up with stronger symptoms compared to the end of the day, it's likely that you've overdone it. While doing activities or exercises, your symptoms are very likely to increase, but that's fine at this stage, but try to keep it tolerable. If not, decrease the difficulty, repetitions, and/or duration of your exercises or activity the next time. On to the post-concussive symptom phase. This is for any symptoms that stick around greater than 1 to 2 months after the injury. First, if you're experiencing annoying symptoms, your approach is to ignore them. If you're experiencing aggravating symptoms, in other words, worse than just annoying but still tolerable, your approach is to try to put up with them. But if your symptoms become intolerable for you, the next time around, change your activities in degree and duration so that your symptoms are merely annoying or aggravating. Now finally, avoidance is not the best policy at this stage. Instead, moderating your activities is a much better approach to getting your life back. If you continue to have problems beyond the 3 months, with all these strategies, it's best you consult an experienced concussion clinician. In the next PT tip, I will cover flare-ups versus new concussions. Also, why do flare-ups seem to happen so frequently? Keep on healing. February 3rd, 2025, revised October 16th, 2025.